Okay, so I'm going to be talking about how we could promote male involvement in sexual reproductive health. And basically, what is sexual reproductive health? Sexual reproductive health is just simply saying that people should have authority over their own body. They should have autonomy over their own body. They should be able to make informed decisions with regards to the things they do with their body, but not just making informed decisions, but know the consequences of whatever action or whatever decision that they might be taking. So for a young person who decides that he or she wants to engage into any sexual activity, he or she needs to know the consequences of engaging in a sexual activity. And for somebody who decides to say, I don't want to engage in a sexual activity, at the same time also needs to know what are the benefits of not engaging in a sexual activity, from deciding what relationship to go into, the type of partners you need to have, from determining the kind of self-esteem you want to have, how to set good and smart goals for yourself. All of this makes up sexual reproductive health. So sexual reproductive health is not just, focusing on sex, but it's looking at sexuality, it's looking at everything that makes up a human being in terms of their sexual health. So that is basically what sexual reproductive health is. And unfortunately, over time, we've come to see that male involvement has been little to minimal. Most times, we don't even have males involved in sexual reproductive health courses or sexual reproductive health issues. But is this something that affects them? Of course, yes, it is. So I will talk about what some of the issues are that males face when it comes to sexual reproductive health. So the first one is contraception. So it's most times believed that contraception has to do with only the women or only the females, but unfortunately, it's not so. Even the men have a role to play when it comes to contraception. They also have needs that need to be met when it comes to their reproductive health and in terms of contraception. So even men as well need to have access to family planning services, for example. It's not solely the women's responsibility. And this is something that a lot of young men, a lot of men struggle with in terms of having to go to a family planning clinic unit, for example, to access contraceptives. It's a big struggle. At the same time, men need to avoid sexually transmitted diseases. A lot of young men engage in risky sexual behaviors, and this puts them at risk of contracting sexually transmitted diseases such as HIV and AIDS. But based on the fact that they do not have access to family planning services, even when they have access to family planning services, because of the stigma that comes with men accessing these services, they do not easily go for it. They believe it is the responsibility of the woman, to take care of that aspect or that area. And that's why you get to see a lot of times when young people, have conversations and they say, she's a woman now, she should know what to do. Two persons have engaged in sexual activity, but then the responsibility now falls on the woman to take care of herself, and then the man feels like it's not his business or it's not his responsibility. Meanwhile, they are both at risk. So this is something that a lot of men struggle with. And another myth or another issue that a lot of people do not pay attention, or a lot of men do not pay attention to, is infertility and fertility. A lot of times we believe or we think that it's only the women that have fertility issues. But then, research has come to show that most times when you look at fertility issues, it's usually on the men, not even the women. But society has made it look like, anytime there's a problem in marriage, in terms of being able to procreate and give birth to children, they begin to look at, the woman's past sexual experience, sexual history, the things that she has done. They always believe and think that it's always the woman that has the problem. Meanwhile, sometimes, the problem is usually on the man, because sexually transmitted infections can also make a man, experience issues like infertility. So this is not just something that affects only women, it's something that affects men as well. So these are some of the issues that men face when it comes to their sexual and reproductive health. Now, when you look at men's behavioral impact on women's health, most times when we talk about sexual and reproductive health, men say, why should I bother? What's my business? Sexual reproductive health has to do with women. I don't get pregnant. I don't menstruate. So why should I be bothered, about sexual reproductive health? But yes, men, in fact, we women have to be bothered about men's activities and men's actions when it comes to reproductive health, because it has an impact on us as women. And I will talk about some of these impacts. So the first that we have, as I mentioned earlier, is unplanned pregnancy. So when a man is not informed and doesn't know that if he wants to engage in any unprotected sexual activity, he has to have access or he has to use a contraceptive, what happens? It puts the woman at risk because then she can now get pregnant. And most times are usually unplanned. Now it's a cycle, it's a vicious cycle. So the woman gets pregnant when she doesn't want to get pregnant. Remember also that there's a possibility that she could also contract a sexually transmitted infection, which over time, if not treated, could lead to infertility in the long run. Yeah. And because it's an unplanned pregnancy, what happens? She's mounted a lot of pressure, society pressure, and then she might want to go for abortion. And we all know that abortion in Nigeria is not legal. So most times, women engage in unsafe abortions, which puts their life at risk, put the life of the child at risk, and has a ripple effect on the emotional and psychological health of the woman. So you see how one decision that one man has taken or one behavior that one man has exhibited has now had a ripple effect on a woman. So these are some of the things that we really need to look into. And just as Ebuka mentioned earlier in his session, the kind of narratives we push in terms of masculinity also has an effect on women, because we now see the trend in abuse cases rising drastically. A lot of men physically abuse women, sexually abuse women. And if you look at some of these men, if you look at some of their history or behavioral patterns, you see that some of them were even victims of abuse themselves. And unfortunately, because of the culture of silence, men cannot talk. Men should not talk. They shouldn't speak out. I mean, it's absurd. The society believes it's absurd for a man to say he was raped, So these are some of the things that we push in the society that has a negative effect on the woman, because sexual abuse is something that nobody wants to go through, because this also has its own effect. And the thing just keeps on going in cycles like that. So that's why it's important that we continue to promote male involvement in sexual reproductive health, ensuring that men are able to engage in positive behaviors regarding their sexual reproductive. When a man is informed and he knows that he has to have access to contraceptives if he wants to engage in sexual activity, he understands the power of gender equality, that everybody is equal, both the male and the female, and he sees the female as an equal counterpart and not somebody who is supposed to abuse or somebody who is beneath him or below him. That way we'll be able to avoid some of the cases of sexual abuse that we currently have. So I'd run quickly to why we don't have male involvement in sexual reproductive health, or why we have limited involvement in sexual reproductive health. The first thing is misinformation. A lot of men are not informed about their sexual reproductive health. When you talk about sexual reproductive health, as I said earlier on, it's always a woman's issue. Men don't feel like it's their responsibility. Why? Because they don't get pregnant, they don't menstruate. So what do I need to know, about my reproductive health? But men need to be informed. We need to begin to educate men. It's not only the women we should be educating, to tell her to keep her legs and not to have sex and not to talk to anybody or not to talk to anybody. We also need to train our boys to understand that, abstinence is also something that they can practice. It's not only for the girls to practice. If at all they want to engage in any sexual activity, let them make use of contraceptives. They need to have all of this information at their fingertips as men, and not just only the women getting this information. They need to understand that when you have a sexually transmitted infection, make sure you go to the hospital so that you can begin treatment on time, so that it doesn't now end up, causing you infertility issues later in life. So these are some of the information that we need to begin to orientate and educate men as they grow in life. Also, another limiting factor is sociocultural norms. I made mention of the fact that a lot of times when men are going through things with regards to sexual reproductive health, the society makes it an hush-hush topic. They shouldn't talk about it. They shouldn't say anything. A man is depressed. He should form strong. He's sad. He should not cry. He's noticing, differences or changes in his sexual reproductive anatomy, in his sexual organ. He cannot even go to the hospital to talk about what exactly it is that is wrong with him, because there's no comfort created around talking about some of these topics. So these are narrations that we need to begin to change. And the fact that, the society believes that we live in a very patriarchal society, where we believe that the man is at the top, the woman is below. We need to begin to change that orientation limitation, so that men understand that both the man and the woman, is equal, and they should also have access to equal opportunities and equal information as well. And one more thing that limits men's involvement in sexual reproductive health has to do with the environment where they access services. Now, when you go to access services like family planning, for example, when you get to family planning units, you only see female workers. When you go to the maternal health care units, you only see female workers. And what does that do? It kind of like prohibits men from actually going to get those services, because a man will not feel comfortable talking about his issues with, a female. He would feel more comfortable talking about his issues with a fellow man. And that is why we need to begin to create those changes in the health system in such a way that we don't have only females attending to sexual reproductive health issues in the hospital. Let's begin to have a mix of both the males and the females. And another thing is, another limitation really has been no provisions for meaningful engagement of men in sexual reproductive health issues. I remember when I was doing a research where I had to interview pregnant women and persons using the family planning unit. And I got to realize that in the antenatal care classes, for the few men that actually accompany their wives for antenatal, they don't allow them come in. I mean, they're like sent back to probably just go and stay somewhere else. They don't engage them at all, But then you look at it, pregnancy is something that involves both the man and the woman. It's not only the woman's responsibility. Those information are information that the men also need to have. So can we begin to have classes for men? Can we begin to ensure that this thing becomes a norm where the man should accompany, his wife for antenatal care, for example. At the same time, we need to start looking at how we can balance this thing. Not only women should have antenatal care leaves, men should also begin to have paternity leaves, so that they would also be able to provide support to their wives, and they would also be able to get the necessary information they need to provide all the care that the wife needs at that time while going through that process. So I'll quickly run to solutions, which is my last subtopic. So what exactly do we need to do to ensure that men are meaningfully involved in sexual reproductive health? And I say meaningfully involved because it's not just enough for you to say, oh, you want to do a program and then you bring in men to that program just so that you can have their names on your attendance sheet and you can tick the box and say, oh, yes, you've actually engaged men, in sexual reproductive health. No. Meaningfully engaging them in the sense that you carry them along from it, part of the design of your program. Let men be involved. Don't only solicit input or suggestions as to how you want to run that program from only the women. Bring the men on board as well as equal partners. Get their input to inform that program that you want to actually implement. When implementing the program as well, make sure you get them involved. Make sure you bring them on board and make sure you make them equal partners. Not, like a forgotten person, that, oh, we've already done this program, but let us just quickly bring 1 or 2 or 3 men or 1 or 2 or 3 boys, so that it will not look as if we did not involve men or we did not involve boys at all. No, that's why my emphasis is on meaningful engagement, not just engaging them, but meaningfully engaging them. So the first thing is we need to increase the number of awareness programs, educational programs that we do for men, leveraging on places where we can easily access them. For example, we know that sport is something that brings men together. Can we begin to use football as a means of educating young men on their sexual and reproductive health? Can we begin to use probably rallies, health outreaches at community level to begin to sensitize and orientate men on these negative perceptions that they have with regards to masculinity and on concepts like gender equality, and providing them with the information on how they can prevent, unplanned pregnancies, prevent sexually transmitted infections, and all of the other things that they need to do as men to protect their sexual and reproductive health. So it's extremely important that we do that. Also, we need to begin to create health systems that allow for men to be engaged. I mentioned earlier that we need to start giving men paternity, leave, so that they can also engage in antenatal care with their wives. It's not only the woman that should be going for antenatal care, the men should also be involved as well. Also, it's important that while we are promoting health workers will be working at the clinics or at the units where sexual reproductive health services are provided. We need to begin to have a balance of both parties. Not only females, should be the persons that work in some of these units. Let's also have men as well, so that men will feel comfortable to approach this unit and actually access some of these services. So my solution, I'll just quickly summarize, is we need to begin to change the orientation by organizing educational programs, awareness programs, leveraging on places where we can easily find men, like football, using football as a medium. We need to begin to change health systems such that we can provide means where men can be involved. Can we begin to give men paternity leaves? Can we begin to make it a culture, or even make it a policy where men actually have to accompany their wives to antenatal care? This is something that we need to begin to look into. And at the same time, we need to ensure that we have a mix of our health providers in some of these sexual reproductive health units, not just only the females providing these services, but also the men. The last thing I would just say is that sexual reproductive health is something that affects everybody, whether you are a male, whether you are a female, whether you're a child, a boy, a girl, an older person. Every single person, has different things that shape their sexual and reproductive health. And the moment we begin to realize that we need to involve men in this conversation and we need to meaningfully engage them in sexual reproductive health activities and programs, then we can begin to say that we are promoting gender equality. We can begin to say we are going a step closer to ensuring that we no longer have unplanned pregnancies in our society. We no longer have sexually transmitted infections. Mind you, young people contribute the largest percentage to the rate of HIV prevalence currently in Nigeria, And what drives some of these things are unhealthy sexual behaviors, not just from the women's angle, but also from the men's angle as well. So we need to begin to do this. And at the same time, we need to ensure that both men and girls, both men and women, both boys and girls have access to sexual reproductive health services. So I'll wrap up at this point. Thank you.
Well, thank you so much, Elizabeth. Thank you so, so much. That was so enlightening. Like, I've learned so much. And I'm so happy that your talk was very solution driven, as opposed to just giving us all the issues. And you actually told us how we could deal with all these things and ways that we could start the process on reaching the desired objectives. Thank you so much for taking our time to be here. So the first question is, what is a vasectomy? Second question is it safe for men? And can it be reversed? Can vasectomies be reversed? Is it safe for men? Then also, when you spoke about sexual reproductive health, we realized that a lot of men are very comfortable with the way things are, the discussion on sexual reproductive health, because nobody's talking about it. It's a very comfortable place for them. So how can it, and if you even think about it, in recent times, we had the thing trending on social media about different men going to have DNA tests for their children to make sure that the children were not theirs and all those things. So what do you think about that space and all those things? Like, do you feel like men would be interested in having the spotlight put on them away from the women? Because obviously that now, a lot of the women who go out and cheat on their husbands and all that do it because there's pressure from in-laws and so many different things like that. Do you think that men would be comfortable with leaving their own comfort zones and having the spotlight put on them? Also, I have another question. Considering the fact that when you think about sexual reproduction in the hospitals, most of those areas are filled with women. The matrons are all women, the midwives, the women, they are all women. So how do you think that we as women, we can get ourselves to be open to actually allowing men to participate? Like during your talk, you gave an example of men who would follow their wives to their meetings and they would tell them to wait outside. So how do you think we as women can be open to having men participate and not just restricting it to be like, oh, are you a woman, or calling them women or and stuff like that, in a way sort of discouraging them from participating, even those men who are interested? Thank you.
Okay. Thank you for the questions, Favor. So I'll take the first one on vasectomy. So vasectomy simply is a form of family planning method. It's actually a permanent form of family planning method. for the men. And what it does is it prevents the man from being able to impregnate a female. The man would still go through all of the normal reproductive processes in terms of he would still produce sperm, he would still ejaculate, all of that would happen. Basically, what happens is that there's a procedure that is done such that there's a block where the sperm cannot get to the vagina. And once the sperm can't get to the vagina, what happens? Pregnancy cannot occur. So it's not something that is reversible. That's why it's called a permanent form of family planning method. It's most times recommended for people who already have quite a lot of children or a large number of children. They do not see themselves procreating or wanting to have kids anymore. Um, yeah, so those are the people that is usually advised for. So it's not a method that is advised for young people because young people just want to prevent pregnancy for a short period of time till probably when they are ready to now start procreating. I think you asked them what, because I think I've answered all the questions on vasectomy. Or was there another
Yes, you have.
question? Okay.
You have. You said it's safe and it can not be reversed. It's permanent.
Yes, it's permanent. It can be reversed. So just the way you have vasectomy, you also have tubal ligation for the women. So tubal ligation is also, it's the same, it does the same thing that vasectomy does for the men. And it's also a permanent form of family planning for the women as well. And so what they just do simply is to block the tubes such that when the woman procreates, the egg can go to the fallopian tube for a sperm to fertilize it. That's basically what happens. So they are both permanent methods of family planning. So for the second question, which was talking about how we can promote male involvement, putting men on the spotlight, and in a way kind of taking the shine away from the women, which is what has happened over time, over long period of time.
Yeah.
I don't think the focus should be on who gets the spotlight or who is in the spotlight. You know, I get a lot of questions from men, especially when you're talking about rape issues. They say, why is it only the women we are advocating for? Why are we not advocating for the men? Men are also raped. Men are also abused. Men also go through, issues as Ebuka mentioned based on the societal norms that we have. They're also going through issues. They also have mental health issues. Men also go through relationship issues. It's not only women that go through relationship issues. So they go through everything. Yes, we accept and we agree with that. But then the truth is, what we are saying is both parties should be involved equally. And it's also possible for you to decide and say, you know what, I want to focus on only the male folks, just the way Ebuka is doing. And for me, I'm looking at young people generally. So whether it's female, whether it's male, I work with both parties. But basically, what we're saying is, let us involve both of them. I'm not about the spotlight, as to who we are focusing on more, because we both experience the same issues, really, just in different ways and at different, volumes, but we both experience the same issues. So there's really, it's not a competition as to which person's issues should be focused on more than the other. It's not. It's just saying that over time, men have been sidelined and have not been involved as much as they should, and we should begin to involve them. And there's another thing again. It's one thing for you to want to involve men, but it's another thing for men to actually want to be involved, because that's the problem. It's okay for me to say, oh yes, I want to involve men in sexual reproductive health, and I want to bring men on board to work with me to do sensitization programs and talk to their fellow men with regards to engaging in, safe sexual practices. That's a good thing, yes. But what happens when I call for men and nobody shows up? Or I tell men, oh yeah, come, let's do this, and then nobody comes up. So it's one thing for us to want to engage them, but it's another thing for them to also see reasons and see, the benefits for why they should actually get involved. And that is why I really admire what Alima is doing through Life After Abuse Foundation, having those conversations via Instagram to begin to change that notion that men should be on the sidelines, and these issues are not things that actually concern them, but it's something that concerns all of us. Then the last question I talked about the health force. So yeah, when it comes to that, I think it's more about health. It's more about the health systems, really. It's not something that one individual can do. It's something that an advocacy. It's like an advocacy effort that needs to be done by multiple stakeholders. We need to do a complete system overhaul if you want to begin to have both males and females running some of these positions at the health centers and the clinics and the family planning units. Mind you, let us even take our minds back. When in school, who do you tell to go and study nursing? You say the females, the girls, right? Nursing is a female course, it's a female profession. Then when it's time for us to study medicine, who do we tell to study medicine? You say, oh, it's more of the men. The men should go and study medicine. So we see how society and societal norms are shaping the things that begin to affect us in the long run. So at every point in time, when you tell a girl not to study medicine because she's a girl, and you tell a boy not to study nursing because he's a boy, what you have just done is you have created a ripple effect whereby we would not have male nurses who can attend to some of these issues. And the same thing, we would not have female doctors who will be able to attend to some of these issues for the females as well. So this is something that we need to begin to change. We need to begin to change that orientation. And that's why I'm a strong promoter for gender equality. You know, I believe that if everybody accepts and embraces gender equality, the society is going to be an amazing place for everybody to live in. Because what it just means is that both the males and the female have access to equal opportunities and equal resources, regardless of whatever it is, whatever differences they have, be it in age, sex, orientation, and all of that. So the moment we begin to ensure that both males and females understand that you can pursue whatever career it is you want to pursue, regardless for that, to ensure that these things are corrected. And at the same time, we need to engage policymakers. I remember Alima talked about the fact that we need to begin to engage a wide variety of stakeholders. Everybody has a role to play, whether you're a male, whether you're a female, whether you're a politician, whether you're the non-profits, whether you're even in the private sector. You know, every single person has a role to play.
Yeah.
We need to begin to engage people at the policy level such that they see reasons why they should put measures in place for men to also occupy some of these spaces.
Thank you so much, Elizabeth. Thank
Thank
you
you.
so, so much.